Okay, it is a little past 10 o'clock. Let's go ahead and get started. Welcome to the special webinar, COVID-19, Being an Effective Opinion Leader. This webinar is being recorded and will be made available following its conclusion. I would like to ask everyone to keep your microphones muted and video cameras off for the next hour. During the session, please type any questions or comments in the chat panel. We aim to begin the Q&A by 10:30. I'm Ajay Sethi, Faculty Director of the Master of Public Health Program. Co-moderating with me is Barb Durst, Deputy Director of the MPH Program.
Hi, everyone. It's really nice to see so many people on board today, and we're looking forward to a great session.
As you know, we are experiencing a surge in COVID-19 cases in the United States and Wisconsin. We have arrived at a point in this pandemic where each of us is either personally affected or we know someone else who is. It is important that we acknowledge and respect how dramatically life has changed for everyone in such a short period of time. Given the unpredictability we face day to day, I would like to thank these distinguished members of our expert panel for breaking away from their work responding to the COVID-19 crisis and joining us today. The goals of this webinar are for you to hear about the COVID-19 response, get key information about what the broader public should know, and receive guidance on how to be an effective opinion leader. Our schedule is shown on this slide. Let's begin with preparing the community, and we welcome Jake Baggott, Associate Vice Chancellor of the University and Executive Director of University Health Services. Vice Chancellor Baggott, thank you for getting us started.
Good morning, and thank you again for pulling this conversation together. Obviously, it's timely and relevant discussion. You know, having been in college health and higher education for more than 35 years, the impact of COVID-19 in particular has far-ranging concerns, and it really presents some really unique challenges. I'm going to talk a little bit about how to prepare a community for a communicable disease outbreak, talk a little bit about how UHS, University Health Services, functions in this public health authority role for UW-Madison in collaboration with our public health partners, and which describe how we're doing our best to provide guidance for more than 60,000 students and campus members of our community that are on our campus during a typical academic day. And so, you know, just recognizing that makes our community about as large as the 10th or 11th size city within the state of Wisconsin. I also want to acknowledge there's no one secret for what to do into this plan. The point is do the plan, go and let's go over what that means. So if we'll go to the next slide. Thank you. We want to talk about identifying our key partners, you know, reviewing the plans that are in place and then meeting with the stakeholders. Thankfully, we're working in a community that has a lot of established committees and work groups. The university has had a campus health initiatives planning team that's been in place for some time. It's an ongoing activity of campus stakeholders that gather periodically and review what our current plans are and anticipate what those gaps might be. And then as you think about who's at that plan, in those discussions, also consider how you would operate in an emergency or crisis situation, such as we are now, and how that you would transition from that, you know, that sort of planning stage into an actual operational stage. And then look at the plan itself. Even if it's old, and it's difficult to keep any plan relevant. Plans are very often a framework from which to start moving forward. An example, UHS created a plan in response to the H1N1 outbreak in 2009, and really had to, you know, hit the ground running and develop that plan to a large degree as the situation was developing. So that plan formed sort of the basis of the current plan, which was then updated in 2015, and now is a more sort of contemporary plan that addresses pandemic flu planning and provides that framework for which we can move forward with. So the other thing about planning is to make sure that that's an ongoing or continuous process. listening to the stakeholders, understanding how the situation evolves, as well as the organization evolves, and keeping that plan or that framework relevant and in front of the key stakeholders during that time. So the next step is really about making informed decisions. The goal, of course, is to get the right people, give them to provide them with the right information at the right time. Timing is critical, and then using the right channels for communication and decision making to support the best decisions that can be made under that circumstance. While we're in an active crisis, whether it was the previous meningitis outbreak that the campus responded to a few years ago, or our current situation, we really want to remind people, understand, if they're safe or if they're not, how can we help support or maintain their safety, and what information do they need to keep themselves and others, as well as our community, protected. And that's really been the focus of a lot of the efforts thus far. People will look to who's in charge, and where that leadership comes from. On a routine basis, the Campus Health Initiatives Planning Group provided a structure for that to happen, but it also created a launching point to move into the incident command structure, which we currently are operating under. And what the leadership looks like under those circumstances is really dependent on the situation. Most emergencies or disaster response plans are built around events that will take place and resolve in a short period of time. Situations like this aren't necessarily that in that manner, and so the plan has to be flexible to allow the support of evolving leadership styles and circumstances, and how to sustain that. Leadership can, in situations like this, emerge from oftentimes unexpected places. Our campus community, our students, student leaders, staff, providers, both medical and mental health providers, and other campus officials will often emerge in situations like this with the right expertise to develop our strategy and help us move forward with that. What's really going to define how well that works is individuals' ability to provide timely, reliable information that can be easily understood and can evolve with the circumstances. And so going to the next slide, what's also important in this brief sort of overview is, what do we learn from our experiences, those experiences we've had in the past, and then what are we learning from our current experience here? And establishing a process to evaluate that, to collect that data, which is usually in the form of a hot wash. It's sort of a very common approach to reviewing what occurred, what did we learn, and then how are we going to use that information to inform our decisions going forward. In a situation like this, hot wash may take place, weeks or months after the end or sort of the stabilization of the circumstances that allow us to create some sort of normalization. And then what's important is to include both the notes that we've accumulated along the way, as well as the feedback from the stakeholders, whether they're campus, community, public health agencies, healthcare providers, and other stakeholders in that process. So we can get all of that experience, the lessons learned, the things that we did well, the things that we would want to respond to differently, to help inform and prepare us for that next event that might develop. So real quickly, in summary, it's about making sure that you start with a plan on the next slide. Understand that plan is often a starting point, but it needs to provide the framework for how you move forward. Providing the information and the data to the decision makers that are actualizing that plan, and then evaluating what the results are of that process through a review process such as a hot wash. And then again, go back to that planning cycle. Use that to update your plans to reflect what you learned from that experience, and then be prepared for that next cycle. I'm going to stop there, and we'll cover the next section and certainly be ready to answer any questions or comments that might come up. Thank you.
Yeah, thank you, Vice Chancellor, for that guidance and for your leadership to our campus community. I'll just remind everybody who's attending that you can use the chat box to post any questions or comments at any time. We will now hear an update about COVID-19 testing, which will be provided by Dr. Al Bateman, a distinguished graduate of our MPH program and currently Assistant Director of the Communicable Diseases Division at the Wisconsin State Lab of Hygiene. Dr. Bateman, please.
Thanks very much, Ajay. Can you guys hear me?
I can.
Okay, sounds good. So my approach here is to include some laboratory details so that everyone can be informed to be able to combat misinformation that they might hear about lab testing with relation to COVID-19. And I'll start just with the name of the virus and the name of the disease. So the name of the virus is SARS-CoV-2, and that is the virus that causes the disease COVID-19. So you'll hear those kind of interspersed sometimes. Some people call it the COVID-19 virus, but they're one and the same, basically. So next slide, real brief overview. I work in the Wisconsin State Lab of Hygiene, which is part of UW-Madison, part of the School of Medicine and Public Health. And there are many different divisions doing many different things, including newborn screening, a lot of environmental testing. We are in the Communicable Diseases Division, so we do infectious disease testing of many different types of pathogens. Next slide. And in communicable disease, we have about 50 people, and we have these 5 main work teams. The bulk of the testing for coronavirus is with the virology team, but we've really had a lot of people volunteering to help out with surge capacity from all the other teams as well. And our role in the Communicable Disease Division is to do laboratory testing on patient samples, both for immediate clinical care. So we're a TB testing lab as well as STDs. And we also do a lot of public health surveillance testing. And originally I had outbreak response, but now we're definitely beyond that into pandemic response. Next slide. Generally, when an emerging pathogen emerges, the very first group to make a test is the CDC down in Atlanta. And the daily capacity, depending on the test, is usually in the couple hundreds per day. And the next step is then CDC getting approval from the FDA to roll out this test into public health labs around the country. And so in Wisconsin, we have us, the state lab, and the Milwaukee City lab as well. And once all of these public health labs nationwide are up and running, each running a few hundred a day, now we're at 10, 15, 20,000 daily capacity tests that could be run. And the next test, or the next step after that, is typically large clinical labs that are bringing on testing. We have a few of these in Wisconsin. There are 7 or 8 clinical labs right now that are up and running, including UW Health. And they're also very large national reference labs. And once these get on testing, then we're talking the dozens of thousands every day potential capacity. And the very last step in terms of broadening all of this testing is where the commercial manufacturers get their FDA approval and get those approved tests. And once they really ramp up and send these tests to small and medium-sized labs, then every microbiology lab in the country can test. And now we're really talking a lot of daily capacity nationwide. So this structure is the general approach that is taken for any emerging pathogen, and this worked pretty well in the 2009 influenza pandemic. It's also been used for the MERS coronavirus that has come from the Middle East in recent years, and for Zika. But the past couple months with some FDA restrictions placed on clinical labs early on, and CDC being the only one that could bring out a test, and initially when they rolled it out to public health labs, it didn't work that well. It set us back a couple weeks in terms of our capacity. So it hasn't been the best rollout, but we are currently in this sort of middle range of large clinical labs bringing on testing, and testing capacity is increasing every day. And we're in a much better place than we were even a week or two ago in terms of capacity. Next slide. I want to talk through a little bit of the details of the main types of tests. So there's PCR, it stands for polymerase chain reaction, and this looks for the virus itself. So it targets a part of the virus genome, and it is the standard diagnostic test currently. Anytime you hear about COVID testing, by and large, it is PCR. And there are 2 main approaches for PCR. There are high throughput tests, which is what we run and what other large labs run. And these are where you take, the best analogy I can think of is baking cookies, where you take all the raw ingredients, you mix them all together, then you make batches of 12 or 24 or however many you can at a time. And you can really scale up pretty well to make large batches, and we do multiple batches of these per day. But you need each of those raw ingredients. That's something that we've been kind of limited on. It's kind of limited our capacity up until recently. The other type of PCR tests are what are called sample to answer, and these are generally faster, but they're lower throughput. So these are more used for the smaller labs, really closer to patient care. And the analogy for cookies with that is buying the cookie dough already and then microwaving one at a time. So all the ingredients are already ready-made, and you can make it faster and easier, but it's lower throughput. The other main type of test that's been thrown around, especially in the past week or so, is serology tests. And these don't actually target the virus itself. They don't look for the virus itself. They look for the immune system response to the virus, antibodies such as IgG or IgM antibodies. These can be pretty useful for both research studies and epidemiology, and in the future will likely be useful to see to assess herd immunity in various areas. But I really want to be clear that they are not a good diagnostic test. Even though they're being sold by some manufacturers or marketed by some manufacturers as diagnostic tests. Because these antibodies become detectable 5 to 7 days, up to 2 weeks after infection, which is much later than the PCR. PCR can detect within a day or two, maybe 3. There are various reasons that the sensitivity and specificity of these serology tests are probably not ideal, and there is no FDA review or approval of these serology tests currently. I really want to make the distinction between the PCR that is the gold standard right now and the serology. Also, in terms of testing criteria, this has been a moving target and changes constantly. All I'd say with that is if you're curious about testing criteria, to check reliable sources like CDC website and the Wisconsin DPH website, Division of Public Health website, for the most up-to-date information. If you are tested, what to expect currently is there's a swab that goes up in your nose, likely a nasopharyngeal, which is way, way back, and it's quite unpleasant at best. That swab is then put into a liquid, and that liquid is sent to, quote unquote, the lab. And if that lab is located just down the hall and running the sample to answer test, you might have results really soon, within a half hour or maybe an hour or two. If the lab is located across the state, for instance, currently if someone in Bayfield has a sample taken and then we test it in Madison, in that case, the sample is usually shipped overnight, and then we result the test within a day or two of receiving the sample. And some of the national labs have really been swamped with testing and have longer turnaround times at this point, but I think that's starting to improve as well. Next slide. So a few key points that MPH students can provide the public is to continue to reference reliable information sources, including CDC and Wisconsin Division of Public Health. To note that lab testing for COVID-19 really we're in the great expansion phase of capacity right now and really continues to expand daily. I just want to make the point that I'm sure you've heard of this drive-through testing, and just to be accurate, this really is drive-through sampling at the current point, because then the sample is sent to a lab and the results come back later. And as of now, there's no at-home testing approved, but probably in the future at some point that will be the case. And just wanted to emphasize one more time that PCR and serology are very, very different tests. Next slide. I'll just end with this photo as some of our virologists and microbiologists in our virology processing lab. Biosafety-wise, we really do take biosafety seriously, and every diagnostic lab does. So we meet and exceed CDC's recommendations for biosafety. On the left and the right there, you see those large, they're called biosafety cabinets. And those, everything is done inside of those, inside a protective curtain of air. And then as an enhanced precaution for potential leaking specimens, which we do sometimes get, we use these masks called N95 respirators, or there's a couple people wearing those hoods toward the right, and those are called PAPRs. And we use these N95s or PAPRs until the virus has been inactivated, and then after that, everything is much more safe. So with that, I will close and await any questions at the end. Thank you.
Thank you, Al, for that summary and for your invaluable service to the state. Our next panelist is Dr. Jonathan Temte, Associate Dean for Public Health and Community Engagement and Professor of Family Medicine. He will now speak about COVID-19 and the clinical environment. Dr. Temte, thank you.
Thank you very much, Ajay. Hopefully I can be heard here. Next slide. Well, as you can be aware, we are having significant challenges out there across the country for a lot of people. And on the front lines are clinicians, but I also want to emphasize that also on the front lines are the kids who are bagging groceries in the grocery store, the truck drivers who are making sure that we're getting supplies distributed, and untold other people who are really important for this response. But I'm going to focus primarily on the clinicians and wear my hat. I still practice at Wingrove Family Medical Center. And the challenges out there are as follows. There's a risk of exposure with uncertain consequences. And a lot of my colleagues have a wide spectrum of being fairly laissez-faire to very, very concerned, and, for example, taking off clothing in the garage before they come in the house at the end of the day. We deal with what we consider information chaos, which is incomplete information, and also information overload. There are rapidly changing protocols for care. And as you have heard all over, and especially in areas like New York City right now, there is a lack of essential resources, particularly the personal protective equipment. And as Dr. Bateman just mentioned, the tests and testing capacity. And then finally, we have an ever-changing work environment. So on these last 2 points, have to just mention I went through my training yesterday morning to don and doff personal protective equipment. And in the training environment, we had to work with fake masks and fake face shields because there aren't resources enough to allow us to use real equipment. And the changing work environment is hitting all of us. We're finding clinics are closing and merging. For example, my clinic and another clinic have just merged, and we're trying to fit all the staff together, which creates additional problems. For example, sometimes overcrowding. Next slide. So the risk of exposure, this is the almost latest version, and we see 800,000 cases of SARS-CoV-2 out there, and a fairly significant mortality rate. So clinicians are facing this with news media reports of physicians and nurses and EMTs and other first responders being hospitalized, and there have been deaths out there. So it ups the ante quite a bit for going to work in the morning. Next slide. This is just a screenshot of my email, and as a physician, I get feeds from UW Health, from St. Mary's, from my department, from my clinic, from colleagues, and all these are relatively uncoordinated. And I could spend my entire day doing nothing but reading emails. And so I'm not saying this is the way it should be done, but this is the way it is. So there's a lot of information flowing constantly that we're possibly supposed to be responsible for understanding. However, there's too much of it, and it keeps on changing. Next slide. Again, there's rapidly changing work environments and protocols. And I take this as an opportunity just to show that public safety message on the right-hand side of the screen. This went out last week, and it just scared a huge number of people. After this went off, I started getting phone calls and emails going, what's going on? And this was simply a test of a system for Dane County and Madison Public Health. But again, we have consolidation of clinics, we have reduction of care, we have movement to telemedicine, we have conflicting information about when a patient should be seen. And again, we have this unending stream of information, which is really challenging, difficult to keep up with, and there can be a lot of frustration with the systems and fear. Next slide. The increase of information has been stunning. This is just a graphic showing the number of coronavirus publications per year. And as you can see, for 2020, or 2020, we're up to almost 2,500 publications in the first 3 months. So again, impossible to keep up. Next slide. And I will conclude here. Just a recent publication that really tells us the importance of having really clear information. So history tells us that an informed, activated population is vital to protecting public health. To make this happen, the global community needs informed and active public policy leadership that employs strategically coordinated health communication and outreach. And this is my segue to the next speaker. So thank you very much, and we'll look forward to any comments.
Thank you, John, for your perspective and for your leadership to the School of Medicine and Public Health. Okay, so finally, we're going to hear about risk and science communication. Our fourth panelist is Sarah Clifford, a student in Life Sciences Communication who recently completed her requirements for the Master of Public Health program. Ms. Clifford, please.
All right, so hello, everyone. Hopefully you can hear me okay, and I'll let you go ahead to the next slide. All right, so first I wanted to talk briefly about what exactly risk communication is. So risk communication is communicating stressful, concerning, or controversial information. And really what it does is it connects the quantitative values of risk with some of the qualitative metrics as well. So within health sciences, we can think about how we can quantify health risk in a lot of ways with epidemiology and various measures. However, when communicating about that risk, it's also important that we take into account some of the qualitative metrics, some of the perceptions of risk that the public is experiencing. And so some of those things that affect risk perceptions are trust. So whether or not people trust the messenger of that information, feelings of control or a sense of voluntariness about that risk, dread. So how familiar are we with that risk? And so looking at some of those things that affect risk perception, we can think about how this COVID-19 outbreak triggers some of these factors that would heighten people's risk perception and perhaps has led to some of the social contagion we've been experiencing with people, perhaps perceiving their risk much higher than we would quantify in a lab. And so we can go to the next slide. And so looking at some of those benefits and barriers to social distancing. So again, one of the big aims of risk communication is to get the public to adapt certain attitudes or behaviors that help with our public health crisis. And so here for COVID-19, it's all about social distancing. And so there was a survey sent out by a group of UW-Madison experts and the League of Municipalities. And so just based on a convenience sample, they were able to get over 26,000 Wisconsin residents to respond about some of their behaviors and attitudes around social distancing. And so what they found here was that one of the primary benefits people saw to social distancing was protecting others. So this sense of altruism or this appeal to people's morality really seemed to be a motivator for people to socially distance themselves. A lot of people who responded to this survey may have seen their personal risk of contracting the disease as low, but this seemed to be a primary driver for why they were practicing social distancing. On the other hand, some of the barriers that were observed in this survey were structural. So things like people needing to continue going to work and provide for their families. Also, people weren't sure what behaviors were okay with social distancing. And really, I think this is a point where us as public health practitioners can intervene and start to provide more clarity on what exactly social distancing looks like. And then finally, one of the barriers were that people were afraid their mental health might worsen. And so this can be a really great point where we can distinguish between physical distancing and social distancing. So telling people that you can still interact socially while maintaining physical distance. And so what I think is most important to take from this is that people are motivated by the common good. And so by listening to the public and some of the things that they're most concerned about, some of the things they're perceiving as the primary risks of this outbreak, we know that an effective way we can communicate with people is by emphasizing how their behaviors can contribute to the common good. And then we can go to the next slide. And so how do we talk then about the importance of social distancing? So from risk communication literature, we know that talking about the high risk of being affected, some of the negative health consequences are not effective. And so this is because that negative framing often paralyzes people with fear. It makes people uncertain what to do. And so a lot of times we see people not doing anything as a result. And so what's more effective is to frame our messages in a positive way and again appeal to people's sense of responsibility and their desire to care for others and how their behaviors in this outbreak can contribute to a healthier community and really prevent the spread of disease. And so the final quote on this slide comes from that survey I talked about on the previous slide. And that was the statement that people in the survey agreed with the most often. And that statement was that practicing social distancing is consistent with the fact that I generally care about other people. So yet again, just emphasizing that people are motivated by altruism, and this really seems to be key in how we communicate the importance of social distancing to the public. And so finally, on my last slide, I talk about what we can do. And so specifically, it's important to understand some of those motivators and barriers for the public to adapt social distancing. So it's important to focus on messages of self-efficacy. Giving people a sense of control over the situation is really important. So self-efficacy is a way we can get there, and working towards the common good. Also, as previous speakers have mentioned, it's important to continue to promote credible sources of information. And then finally, I just included here that it's important to admit what we don't know. So we've heard that the situation is rapidly evolving. Every day there's new information coming out. And so it's important to be transparent about that with people. And so I think that's valuable as we communicate with the public about some of these health risks. And then if you have any questions or comments, I look forward to answering them.
Thank you, Sarah, for your valuable insights and for guiding all of us. And again, thank you to all our panelists for your excellent primers and sharing your expertise with us this morning. Let me now transition to our Q&A session. We will go until 10:55 a.m. so we can leave enough time to summarize and wrap up this webinar. And I'll hand it now to Barb Durst.
Okay, hi everyone. We have a few questions and I'd like to see some more come up on the screen, but our first question is for Dr. Bateman. How does the announcement from Governor Evers yesterday regarding increased testing partnerships fit into the previous testing timeline?
Thanks for that question. It is a good question. We are in the middle of having the large labs around the state, both the labs that were mentioned in Governor Evers' partnership announcement yesterday, as well as other large labs at hospitals that are currently getting on board with testing. And also some of the small and medium-sized labs are trying to get kits from manufacturers to bring on their testing as well. So I think in the coming weeks is where the increased testing partnerships will really start to implement and ramp up testing. And it really is a day-by-day sort of thing.
Thank you. We have another question for you, Dr. Bateman. This one is from Margaret. I saw companies have recently received approval for test development, i.e. Abbott Labs. Is that most likely a serology test or PCR?
That is definitely a PCR. The FDA keeps a list on their website of which ones have the approval. And the approval is called an EUA, Emergency Use Authorization, since we're in an emergency right now. And those are all PCR. There's 22 so far, and new ones are being approved almost every day as well.
Okay, thank you. So we have some questions. I guess this would be from Sarah, but I think all of our panelists could chime in. We'll start with Sarah's response first, and then the rest of you can chime in. So what are some ways that we can talk to kids about the pandemic, social distancing, things that they see in the news, et cetera, in a way that doesn't frighten them, but also informs them?
Yeah, I think this is a great question, and I've seen some really cool strategies out there First, just teaching kids about, what are germs? What is this virus that we're all talking about? So having somewhat of an educational lesson on the nature of this outbreak, I think, can be really informative and really beneficial. So again, giving people information, keeping people informed can be really valuable in ensuring that people understand what's going on and feel a sense of control. And so another note, and something I emphasized for the general public as well, is again to focus a lot on the positive framing. So emphasizing self-efficacy and talking to your children or to kids about some of the things that they can do to help protect others. So the importance of hand washing and why we do social distancing. And again, appealing to that sense of altruism or how we're helping the common good through some of those behaviors. I think that's really valuable to give kids a better sense of what's going on, but also make them feel comfortable that the behaviors that they're adapting, that families are adapting, are helping prevent, a worse outbreak that we could be seeing.
I'm going to also jump in here for just a different sort of view. And for the last 6 years, we've been running a study in Oregon, Wisconsin, where we're really working a lot with school children around issues of respiratory viruses and doing a lot of home visits. Both Dr. Bateman and Ms. Clifford have been involved in this research as well. But the take home I can give you is that children all the way down into the early grades are profoundly interested in what we have been doing. They're interested in the whole idea of respiratory viruses and so on. One of the opportunities we have right now with millions of children being at home and away from school is the whole area of science teachers and health teachers including something on this evolving pandemic into lesson plans and taking the fear and the mystery out of this and making it part of the dialogue.
Okay, thank you. Thank you for your input. And I have a question. There was sort of a general theme between all of our speakers about promoting credible sources of information. Perhaps you could each share what you feel is a very important, credible source of information that our students can look at or can consult on a regular basis.
So this is Jake. I'll take at least an initial stab at that question, and that's something that we regularly contend with, particularly when you have a situation that's developing and in a rather rapid manner. That with all the different sources of information that are available to us, really focusing on those sources that have the most reliable information I think are really important for us to do. And so we keep coming back in our messaging to what does the science tell us, what does CDC, what does DHS, and what does our local public health department tell us in informing our policies and our strategies and our response to this situation. And those are the three that we really anchor most of our messaging around or to, and that are generally understood and respected, and we try to present it in such a manner that it's digestible, but also link it back to to those sources where other individuals want more detailed information, so that they can understand that. There's just a myriad of other data available out there, and everybody's trying to consume as much as they can, and that doesn't make it challenging to kind of keep on focus with what are the things that we can meaningfully do with our information messaging.
Okay, thank you. Any of the other panelists want to weigh in on that question?
Sure, this is Al Bateman. I would definitely concur that CDC and DHS are the main ones to go to. I would also just want to add there's an email listserv called Promed Mail that is about everything emerging infectious diseases related. And they had the initial emails in early to mid-December of last year saying there's an outbreak of unknown etiology in the Wuhan area of China. That was the first time that most people around the world were aware of anything happening in that area. So if people are interested in infectious diseases globally, Promed Mail, it's free to sign up to, and I would very highly recommend it.
Thank you.
And I'm going to follow along and just kind of make the comment that should be made that we have had a number of large-scale public health concerns and emergencies out there in the past decade, going back to the pandemic influenza of influenza A, H1N1. We've had MERS, we've had Ebola now twice with outbreaks. We have seen the Zika outbreak across Central and South America. And in all those cases, the Centers for Disease Control has had a very strong lead, not only nationally, but globally. And I think for students who are studying public health right now, this is going to be a very interesting case study to look at how CDC has been, to some extent, sidelined by a lot of this. And I think we're feeling the lack thereof. When I'm asked for opinion where to go for the best information, I will always, as has been mentioned previously, direct people to the CDC, to the Wisconsin Department of Health Services, Division of Public Health, and for more local, to their public health department locally. But this is going to be a very interesting retrospective view when we get through it as how the communication was handled and to some extent mishandled.
Okay, thank you. We have a number of other questions, so I'm going to jump to one from Deanna. What is being done in Dane County? What is being done in Dane County to communicate these messages to populations that speak Hmong, Spanish, Vietnamese, etc.? What channels are people using to deliver these important messages and updates to these communities?
So I'll jump in. This is Sarah. So I think this is a great question. And of course, anytime we communicate these important messages, it's important that we're reaching all audiences, right? And so I can just speak from knowing personally that the public health website for Madison and Dane County does have all of their COVID-19 related information and updates in English, Spanish, Mandarin, and Hmong. So that's one way that they're at least making that information available through their website. I don't know if the other speakers know anything further that's being done, but from my experience, that's what I know about the communication.
And I'll just add to that on the campus communication strategies that was incorporated from the very beginning, knowing that we needed to be able to provide the information in a manner that could be quickly digested and understood by folks who have different first languages. And so that's been an important part of the strategy, and do that as real time as possible.
Okay, thank you. I guess I'll throw this out to the whole panel, and people can ask or answer this question. What is the best way to maintain trust while potentially changing the message? For example, the CDC is debating putting a message out promoting facial covering and mask use when they previously stated that not to use masks, or that masks were not necessary for the general public.
I'll just mention very quickly that the rapidity of information on this evolving situation is almost unbelievable. The amount of information coming out on a day-to-day basis, and the information challenges our preconceived notions oftentimes. In the last 3 or 4 days, I've seen papers that have suggested a mortality rate for COVID-19 disease as high as 6 to 7% and as low as 0.6%. So we're constantly having competing information coming out, And I think the most important is to have that honesty, saying that there are uncertainties. We're making the best decisions and providing the best advice that we can based on the current knowledge, but also acknowledging that this is a very fluid situation and the information as it evolves will affect the recommendations we are able to provide.
Okay, thank you. Does anyone else want, any of the other panelists want to respond?
I'll just echo what Dr. Temte said. I think this is a really important question. So how do we maintain trust when information is constantly changing? Maintaining transparency, so being very open and honest with the public is very important, as well as being timely with that information. So again, those are things we know from risk communication literature that are very important to communicating risk effectively. And so continuing to do that, emphasizing the fluidity of the situation while being transparent about how things are shifting, can be a way that we can hope to maintain trust.
Okay, great. Thank you very much. We have a couple of questions that are a little bit similar, and they are basically that for individuals who feel like they want to do more, they're practicing social distancing, but they want to help in the situation with things like food security or food insecurity. What are the additional things that we can tell these people about how they can be helping others while also keeping themselves and everyone around them safe? And that can be anyone on the panel could answer that question.
So I'll answer that question from some of the conversations we've had on campus, and I'll use an example of the election process that's coming up. We know that the elections are still on schedule for April 7th. There's going to be challenges with making sure that the polls are staffed appropriately and available for individuals to participate. And so, there's been a number of students that have expressed an interest in trying to support that. So we're going to be working on messaging for students who want to participate, that how to protect themselves, and what are the ways that they can mitigate the risk that they might experience, yet still support this really important civic engagement opportunity for our students. And I think that could also apply to issues around food pantries, food security, and so forth. Those are a couple of examples.
Thank you. Other panelists who want to respond?
I'll just mention very quickly that the availability of social media everywhere allows very rapid dissemination of information. So when the question first came up, I can confess that I had heard about various opportunities, but I didn't have anything particularly to mention. But simply going to Google while Jake was talking, you find all sorts of information. So for example, the United Way of Wisconsin has a volunteer coordination association for COVID-19, and I found that literally in 10 seconds with a click here to assist. So there are a lot of opportunities both on campus, within local communities, and beyond. But I think one of the benefits we do have is the availability of communication that is repopulated and updated very, very quickly.
Okay, thank you. Dr. Sethi has a question.
Yeah, thanks, Barb. So I'm going to read a question that came into the chat earlier and then add to that. And the question was, what are the best ways to talk to friends and family who aren't taking the precautions seriously? And my addition to that is, how do you sort of respond to someone in the community who feels like we should steer away from physical distancing policies and return to business as usual?
So I think this is a challenging, problem. Many of us do know people in our life who aren't taking these precautions seriously. But I think it depends on your relationship with the person, perhaps to some degree, if you're talking to a personal friend or family member who's not taking it seriously. But something I can cite from communication literature is that people generally respond a lot better to stories rather than facts. So you can give people all the information about how the disease is spreading throughout our communities. However, in a lot of situations, it might be a better approach to actually talk about some of the stories of people who have been affected by this disease, families who haven't taken this seriously and continued on with large gatherings. And, there's lots of situations where we can see how this has been detrimental when people are practicing social distancing. And so from my personal experience, and then also from what I've learned, is that these stories can be very beneficial and can give people more of an emotional connection to what's going on rather than just getting the science. Even though the science in some situations can also be beneficial, I think stories have the power to really change people's attitudes and behaviors.
One thing that Sarah had mentioned was this sense of altruism in people who were actually practicing social distance. But we know from many examples in the immunization literature that the public health or the benefit to others argument oftentimes doesn't go very far with people who are not wanting to vaccinate or vaccine hesitant. What has been shown is kind of a combination of both the individual benefit or the self benefit or family benefit coupled with the public health benefit does carry some weight as compared to just the public health benefit alone. And I think, as Sarah mentioned, there are unfortunately too many anecdotes out there of people who are young and healthy and having significant bad outcomes with this particular virus, that those anecdotes can help propel the further message of social distancing for yourself, family, and for the community.
Okay, thank you. It is now 10:55. We still have some questions in the chat box, but I believe this was the time that we were planning on ending. So we can perhaps see if we can answer some of those questions offline after this session is over. So we really thank everyone. Thank you for your participation and your great questions. And again, sorry that we weren't able to get them to all of them. We had some really great takeaways from each of our leaders, leaders today. Some of the takeaways from Dr. Baggott were that, campus leadership has been working on this for a long time. And we know in public health that planning and preparedness is very important, and that flexibility has been the key. We know that that sort of the whole cycle of planning is really important. So planning, making informed decisions using science, having that hot wash or that evaluation, and then restarting that planning cycle. And we know that some of the leaders that have come from this outbreak are not leaders with the big L, but small L leaders that have come out of different sectors. From Dr. Bateman's presentation, or part of the presentation, we have learned that Wisconsin's testing capacity continues to rise, and that that it's continuing to have we're continuing to have more testing capacity, and that the State Lab of Hygiene is working very hard to keep up with the demand. From Dr. Temte, we've learned that there's, we're overwhelmed with information, that it's important to find key important credible sources of information, such as the CDC, DHS, and local public health departments, and that things are continually changing, and that we need to stay on top of that. And we also learned from Sarah that really one of the ways to really motivate people is to help to them to understand with their sense of altruism and their moral obligation, and that seems to be very motivating. And as public health professionals, we can, one of the things that we can do is message to our friends and family, children, loved ones about what behaviors are okay during physical distancing and what behaviors are not okay. So thank you all, and I'll turn it over to Ajay to wrap up.
Yeah, thanks, Barb, and thanks for just providing that great summary of each of the panelists' take-home points. I feel like we accomplished a lot in the last hour, and once again, thanks to the panelists, Vice Chancellor Baggott, Doctors Bateman and Temte, and Ms. Clifford for joining us this morning. We're grateful to you for being here and for your important roles in managing and responding to the COVID-19 crisis. And finally, thank you to the students for attending. We hope you found this helpful and insightful as you move forward and engage with your communities. This webinar was recorded and will be made available to you and others to share. A copy of the slides will also be provided. And if you have any questions or feedback about the webinar, please feel free to contact us. And please be safe and healthy, everyone. Thank you.